Hi, I'm Dr. Pirko. Welcome to Ideal Plastic Surgery. Today, we would like to talk about a facelift. This is a procedure that I'm well familiar with because not only do I perform them, but I've had it done. So I can tell you firsthand what my experience was like and what the different options are within a facelift. There are so many different names that are marketed and it's very confusing, but we're going to try to simplify it and explain clearly what we can do safely, what the potential risks might be, and what the recovery is like. Let's start in the operating room. During a facelift surgery, there are many options, but for most patients, what we're trying to include is for sure the mid-face, the lower face, and occasionally even the brows. We traditionally do not include an incision at the hairline because it tends to be a little bit too visible. We try to start somewhere in the side of the temples and extend it in front of the ear and go behind the ear to go brows, mid-face, lower third of the face, and neck, which is usually included in a full facelift. Through these incisions, with the patient completely asleep, we're going to raise a flap that's going to elevate all the skin going over the cheekbones, down to the folds that are between the nose and the cheek, and all the way to the lips, and down below the jowls, and into the midline at the neck, all the way down to about here. All the skin can then be separated, and that allows us to look at the layer that is below the skin, which is the SMAS. You may have heard this, the superficial muscular aponeurotic system. That's the layer of tissue that puts the muscles together that are underneath the skin, and that's where the tension sutures are placed now. We no longer like to do what was done in the 70s where we just pulled the skin tight and made people look like astronauts. We instead like to raise all the tissues back into the proper position by putting the stitches deep onto the SMAS layer. And in patients who've got a very broad face, sometimes we even excise a piece of the SMAS rather than folding it over itself, which is called plicating. After we do this folding and repositioning of the SMAS, we then layer the skin on top and cut off the excess without putting undue tension on it so you don't look pulled, but instead look refreshed. And we will suture everything with sutures that are going to stay in place for about a week and then have to be removed at a later date. And we're going to leave a drain underneath the skin on each side and bandage you up completely. This whole process takes about 3, sometimes 4 hours, and it is a process that is usually done with the patient asleep. If you really are against general anesthesia, we could do it with local and sedation, although that tends to be much more uncomfortable. We strongly encourage you to go to sleep, but it's a dealer's choice. Let's go talk about the recovery. Recovery after a facelift is surprisingly easy. I've had one done. And the first night, you have a little bit of burning, and you've got that big bandage, and you've got the drains in place, and it's a little uncomfortable. You come back the next day, we remove the bandages, remove the drains, and you're free. The only thing that I thought was a little cumbersome was having to sleep on my back because I usually am a face sleeper and we don't want you to sleep face down for the first 2 weeks. So I had to sleep propped up a little bit, which I thought was very difficult, but it wasn't painful. If anything, it all felt a little bit numb and funny and the occasional little bit of tingling. I think I took the pain pills for 2 or 3 days and stopped taking them. There were stitches in place and you have to come back after a week to remove all of the sutures, and after that there's gonna be a little bit of redness where the sutures were placed, and that can persist for a while. You know, it fades away slowly, but in the end, on most patients, it's going to be very nicely hidden. It depends a little bit on your scar formation. I happen to be a bit of a keloid former, and I still have a little bit of a keloid here that you might be able to see on the camera. Most people are not going to have bad scarring, but if you do, there are some tricks that we can use later on with scar management to make them as good as possible. The recovery, like I said, requires minimal downtime from going to work or even to the gym. Most people are going to go back to work after a week. If you're really, really worried about people seeing it too obviously, then you might have to take 2 weeks off work. Going back to the gym 2 to 3 weeks after the surgery and feeling like 100% recovered, typically 6 weeks, maybe 2 months afterwards, where everything is completely back to normal. Thank you for choosing Ideal Plastic Surgery. We are the biggest plastic surgery center in California, and we have reached this unique position by taking care of you, our patients, with our entire team approach. Everyone here is a certified professional with lots of experience. Our team of surgeons, our team of anesthesia providers, nurses, techs. All we do is plastic surgery, and we do it with full passion in order to give the best possible results, learn every day, improve every day, and give you, our patients, the safest and best results and continue to grow together. I am confident that you're going to achieve the results that you want for your surgery with Ideal Plastic Surgery and look forward to seeing you here soon. Thanks.